You can also use it internally if someone has a heart attack. Now, I had read about this, but I experienced it once, and it was when we had our health retreat in Melbourne. I got a call from one of the staff. A lady's had a heart attack in the middle of a cooking class. So I ran down. I was there in 3 minutes. The lady's lying on the ground. Her face is white. There's a guy holding a pulse. He said, "The pulse is gone." Almost. I said, "Quick, cayenne pepper." I got a half a teaspoon of cayenne pepper, quickly put it in her mouth. She was half conscious. We're able to give her a little bit of water to drink. Within 2 minutes, the guy holding the pulse said, "The pulse is strong." All the colour came back into her cheeks and she sat up.
Okay, so let's have a look at this story. And before you think I'm dissing natural remedies, let me just tell you that I'm an emergency medicine doctor, but I'm also an expert in essential oils and nutrition, and I love to use an integrative approach to health. But there are a few things that I think we need to just cover with this story because it's been doing the rounds. Now, first of all, there's no indication in this story that this lady actually had a heart attack. She had a collapse. It sounds more like she's had a simple faint, which would fit with the thready pulse and the very quick coming round. If someone is having a heart attack, there's actually evidence that shows that chewed aspirin gets into the bloodstream quicker than if you swallow an aspirin, and that is the correct thing to do because it helps the blood not clot, so it inhibits platelet aggregation. Now, cayenne pepper is thought to have compounds that can improve blood flow. But how much is open to question, and are you actually going to risk your health having that instead of an aspirin? And if you do suspect that you're having a heart attack, you need to be going to either call 999 or getting to your local hospital, not to the spice cupboard, to go and get cayenne pepper. That's the most important thing. I think some of these stories, they are not the right thing to do. And from what I've heard this story now and watched Barbara speak, I have no doubt that this lady was not having a heart attack. It was more likely that she had a faint. She was going to recover anyway. Once she was on the ground, the blood starts flowing again to the head and it's natural for her to recover. Maybe popping some cayenne pepper had the equivalence of smelling salts and bringing her around. Who's to say? But I don't think this lady was having a heart attack in the first place. So really take this with a pinch of salt. Cayenne pepper can have some benefits. It's got compounds in that are good as an antioxidant, so helps with inflammation, possibly can help with blood flow. Add it into your diet as part of a healthy, nutritious eating plan. But if you do suspect you're having a heart attack, grab that aspirin instead.